Hi, this is the dermatology case. My case is patient case 4. So just a summary is like a 14-year-old came in for orthotics, but then there's also a rash in his lower extremities. The patient also informed that the rash has reddish to purplish color, and the patient also reported there's pain at his elbows, wrists, knees, and ankle. So most of his joints are very painful, and sharp abdominal pain from mild to severe. So here we've got from the case histories some key diagnostic factors that show it may be HENOCH, SCHOLEIN, PURPURA. My provisional diagnosis is that it has a triad: arthralgia or arthritis, abdominal pain, and rash in the lower extremities. From the case history, some diagnostic factors are that it's male gender, the onset of age, painful joints, rash on the lower extremities, and abdominal pain. These factors are all suggestive of HENOCH, SCHOLEIN, PURPURA. The rash, which is indicated by the mother, is a red to purple color. That's suggestive of the purpura, which is the pooling of blood in the small blood vessels. The description that the rash has spread to the lower extremities is also indicative of this condition. The lesions can be 2 millimeters to 10 millimeters in diameter, and it can occur in crops and fade over days, which is also mentioned in the case. HSP is the most common small blood vessel vasculitis of the childhood, commonly found in male children between the ages 3 to 15 years old. This distinctive as it also shows signs of joint pain and abdominal pain. There is also another possible component, which is urinary tract infection. Here are some of my differential diagnoses. The first one is idiopathic thrombocytopenia purpura. The clinical presentation is very similar, that it has rash, which is petechiae, or along with purpura. Purpura echinosis and monorrhagia is also seen in most patients with this case. But both arthralgia or abdominal pain are very uncommon signs. The platelet level is also a significant factor that is very low in patients with ITP, but normal levels are found in patients with HENOCH, SCHOLEIN, PURPURA. Some risk factors for this condition are that you're black ethnicity, female gender, obesity, pregnancy, and people who have undergone cancer therapy. The common age onset is about 30 to 50 years, so it's very rarely found in children. The second one is hypersensitive vasculitis. It's a type of cutaneous small blood vessel vasculitis, which is where there's an inflammation of the small blood vessel. It's a purpuric rash is most commonly found at the lower extremities, which is also palpable, and where hydrostatic pressure is the highest, so it's also found in the buttocks as well. But this condition also has other skin lesions that are present, such as red macules, ulcers, urticarial, curial vasculitis, which is the wheals, as you can see in the picture on the right, on the upper limb. You can see wheals, red patches on the skin. Some of the lesions covers the lower limbs, but rarely in the upper limbs and trunk. This condition is drug-induced, which is found in a study that is most likely 4% of it is caused by a drug hypersensitivity. Infection is also 8% in a study, and it shows that the upper respiratory tract infection can cause this condition. And this image, which shows the left hypersensitive vasculitis with palpable purpura on the lower leg and urticarial vasculitis on the right picture. So the third one is granulomatosis with polyangiitis. This is another type of systemic vasculitis with involvement of the upper and lower respiratory tract. The age of onset is usually 40 to 60 years old, and it's very uncommon in children, but has an equal gender distribution. It's present with purpuric skin lesions that can be found on the upper limb as well. There's also other skin features that can be noted, such as you can find nodules, you can find hemorrhagic skin lesions, and also ulcerations. So this condition is known to be a multi-system disease where the upper and lower respiratory tract has infections, and it could occur including mucosal bleeding and inflammation. And in the lower respiratory tract, there's a reduction of airway, entry of air, and also you can hear crackles. Patients may also have fever, anorexia, weight loss, and malaise. Neurological components also are numbness and headaches. You can also have tearing, redness, and pain in the eyes with visual blurring or loss of vision. There's also skin lesions that I mentioned before, and arthralgia, joint swelling, and muscle weakness. Another component is also renal impairment. So multi-system disease. So the fourth one is systemic lupus erythematosus. This is a chronic disorder that mainly affects women in their reproductive years and is very uncommon in children. It involves both the skin and joints. Usually it has a facial rash known as the malar rash. It's known to be erythematous rash, flat, and has a butterfly shaped over the cheeks and nose. This also causes musculoskeletal pain, oral ulcers, fever, arthritis or arthralgia. Raynaud's phenomenon is also common. Renal involvement, there's also abdominal pain, and fatigue is another sign. It's also a multi-system disorder. So the fifth one is rheumatoid arthritis. Affects young females of the younger age, such as less than 6 years old, and has a family history of autoimmune disease. They are both risk for juvenile rheumatoid arthritis. Arthritis has to be present for at least 6 weeks with swelling, warmth, and effusion, painfulness, and also limited range of motion. Rheumatoid factor is also present in people with juvenile rheumatoid arthritis. Joint pain and swelling and limited range of movement is common with fever. There's also morning stiffness is a common sign where you have stiff gaits in the morning, limping, and also limping during gait. Rash in juvenile rheumatoid arthritis are often non-pruritic in nature, has an erythematic rash. Salmon-colored rash can be seen in the trunk and proximal extremities. So this is my differential diagnosis tree. I've tried to add most of the differentiating points. So just to summarize, just for idiopathic thrombocytopenic purpura, I've said that there's also petechiae and purpura on the lower limbs, but from noting that there's uncommon signs of arthralgia and also arthritis and uncommon signs of abdominal pain, and also that if you do a full blood count, it can confirm that there's thrombocytopenia. For the hypersensitivity vasculitis, you have to have some kind of hypersensitivity to a certain drug or an infection. But the clinical presentation is also very similar, that there's palpable purpura at the lower limbs. For granulomatosis polyangiitis, there's also purpuric skin lesions, but there are also other signs such as hemorrhagic and ulcerative signs. And if you do a biopsy test, you can also find that there's granulomatosis inflammation. You can test positive for it. Another differentiating sign for systemic lupus erythematosus is that there's a facial rash. Its most distinctive is the erythematous rash on the face. And for juvenile rheumatoid arthritis, you have to have a family history, and you have to be less than 6 years old. Sometimes it affects the females, most commonly affects the females. The lesions are most likely salmon colored in the trunk or proximal exterior, and also there's another distinctive, it's a non-palpable purpura, so it's very, very flat, and so it differentiates from HENOCH, SCHOLEIN, PURPURA. So the main focus is that there's palpable purpura. There's also, it's distributed to the lower limbs. There's painful joints, abdominal pain, and there we go. Thank you.